In this video, I wanted to address the topic on how to permanently fix one right-sided lower back pain, mainly being caused by right QL muscle stiffness, at times erector spine stiffness. So as I'm continuously talking on my YouTube channel, there are certain areas on human body that reacts negatively to you developing hip asymmetry, inability of your pelvis to rotate properly, and so on and so forth. For the last years, I've been working with a lot of patients, both in the office and through the online coaching. And I can tell you for the fact that the right-sided lower back pain is the most frequent, the most popular area of compensation and pain that occurs because of the left AIC pattern or pelvis rotation to one side, lateral pelvic tilt, you name it. So to explain you better, I wanted to share with you today the experience of my online patient from the US who successfully got treated and who restored his ability of his pelvis to shift and to alternate to either side. And as a byproduct, he lost his pain in the right QL pain, left groin, and the left shoulder. How much was the improvement?
Well, I would think the worst three areas would be my shoulder, left groin, and right QL. And those probably at least 90 to 95% better. Sometimes I feel like 100% better. I really don't feel pain in those areas much anymore. I can't even explain how much better things are. As far as the pain in those areas, so much better.
Alright, so as you can clearly see, this is a Jim's posture beforehand, before we started our therapy. A few things that you can notice right away: that his right shoulder is dropped down, which is fairly typical, but it also center line of his abdominal wall being turned towards the right side together with the belly button, which indicates the rotation of the sacrum bone and pelvis passively towards the right. Now the very interesting thing is, yes, indeed he is a little bit shifted to the right, but as he walks, you barely see any alternation, any shifts whatsoever. He walks like a statue. Both of his hips and rib cage are completely frozen and lack of ranges of motion, which indicates of PAC pattern. This is his after walk. Take a closer look how his right hip is moving up and down, giving the chance for right QL to relax and compress accordingly, as it should be by the nature. A big, huge difference. Left image shows you the before, and the right image shows you after 5 months of the therapy. Clearly we worked a lot of improving the stance itself and walking itself, because throughout the years his brain associated this twisted position of the body as a normal status quo, and we would have to break it intentionally. I want you to take a closer look on Jim's walk. So as he walks forward, you can clearly notice a lack of ability on both of his sides of the body to shift. So as he walks forward, he basically walks like a stiff statue. There is no alternation between sides. There is no rotation of the hips, of the femurs, of the rib cage. He just basically being stiffed up in one plane of motion, which is sagittal plane, and that we call PAC pattern. No, PAC pattern is not about overarching the lower back, as you may learn from the internet. PAC pattern is inability of your body to shift, to turn to either side. Because if you get just stuck in the classical asymmetrical pattern to one side, yes, some of the rotation, some of the hip swing, range of motion still being preserved. But when it comes down to this case, this is a completely another story. And firstly, we would have to separate left side from the right side. We would have to break down that statue and make him a little bit more mobile with more ranges of motion. Afterwards, we can address directly any kind of asymmetry that he has in frontal plane and in transversal plane.
So my name's Jim, and I've been dealing with pretty much chronic back pain my entire life. I'm 50 years old now. It's been a long time. I would have these blowouts. I would sneeze and blow out my back, and I would not be able to walk for 10 days. This would happen, often. So I visited chiropractors, massage therapists, physical therapists, occupational therapists. And at best, I would get temporary relief, which would kind of just return after a couple days.
Jim, could you really show on yourself the areas of the pain, or maybe describe where exactly did you have a pain before?
Sure. So at some point, I learned what my QL was, but it was always right side.
Yes.
This area right here.
Okay.
Horrible.
Mostly that pain.
So besides PAC pattern, what happened to Jim, he got stuck in the frontal plane where the right hip was constantly a little bit raised up and moved backwards. On the opposite hand, the rib cage was moved towards the left. We call that abduction of the rib cage. So that abduction of the rib cage creates his right shoulder to be lowered. So this position of the bone predetermines the tension in the right QL. Right QL will be always on when these bones are being connected closer together like this. So what we had to do is to recode his ability of walk differently. And a lot of exercises for that matter has to be done. So he would have to drop the right hip down with proper muscles, not just to move it down, but with proper muscles, and abduct the ribcage towards the right. So that would create an elongation of the right spine muscles, which will eventually let go of the pain that he had there. It took us a lot of energy, but the most confusing part is that you could have a left pelvis elevation and still have a pain on the right side. And the treatment would be slightly different. You could have the similar type of condition that Jim had and have the pain on the left side of your body. Or, just like my patient from Canada, Samuel, had, you can have a left lower back pain associated with left pelvic tilt.
My left pelvis came back down like this. It's not tight anymore. It's like my body just let go of that muscle in a way, so it doesn't hurt at all. Completely, yeah.
So that's bringing a lot of confusion to people, and I certainly know that. So if you want me to help you, basically I can predetermine whether you are an eligible patient for this kind of online coaching. Hit me up with a quick email or just message me through the link below, and I will determine whether if I can work with you together. I have very limited amount of space with who I can work throughout the months, throughout the years, so I'm not working with everyone. But if you are determined to work on your situation, and if you want to get rid of that permanently, potentially I can work with you. So click the link below or just email me and we will figure it out together what to do next. The second thing what Jim had to overcome is not just the ability of his body in the frontal plane to move toward the left, to drop the right pelvis down and elongate the right side. It's not enough, quite frankly. The second compensation that he developed is his pelvis was turned towards the right and never truly was able to rotate to either side. You just got stuck here and that's it. So if that is the case, if the pelvis is turned to that direction, my body at times will adopt this strategy where if the right pelvis cannot move forward like this, it just got stuck here, my body will try to recreate that movement of the right pelvis with the lower body muscles. So as I walk, my body will push my lower back forward instead of pushing my pelvis forward. That's why these muscles are getting overused, because your body tries to push you forward somehow. Your body always tries to compensate, always tries to help you. Despite this compensation creates a lot of problems and pain still. This is the ability of our brain to create compensation over things. So we would have to move his right hip forward accordingly. And I will show you the technique in this video that on the initial basic level could help you with that kind of dysfunction.
I remember you also mentioned a little bit of the upper body, rib cage pain initially when we just started.
Yeah, so the QL was most of my life, and then probably in my late 40s, I was introduced to somebody who did QL release on me, and it kind of made me realize that, oh, maybe there is hope. which if I fast forward to about a year before I reached out to you, I had started going online and I found a bunch of people and I finally figured out what PRI was and what the left AIC pattern was. And I started doing some exercises on my own at home, and I think I made things worse. So when I reached out to you, I could barely walk. I had my left groin was so bad, and my left shoulder I could not press above my head with 5-10 pounds. It was so bad. So yes, it was left groin and left shoulder were just totally dysfunctional.
Yes, but now there is no signs of this kind of discomfort, yes?
No. In fact, I remember our first call, you had said, for now, just stand on your left leg and put some of your weight more on your left leg and try to feel your left hamstring. And I remember my left leg just started shaking immediately. And you had kind of said, that's what we're looking for. And I want to say within 3 days, my groin pain was probably 50% better. And then we had started working on the first round of protocols. And I think probably 2 weeks in, my shoulder and my groin pain were at least 50-60% better.
All right. But now it's like completely gone or almost completely gone.
And now I don't even notice the groin pain anymore. And my left shoulder is, for the most part, equal. I can press the same weight with both hands now. So that's a big improvement.
I'm curious to ask you, because I haven't asked you before, but it's a very legit question to ask. So what's the difference between you working on your own, just like you mentioned before, and you working with me? What's the difference between? Because we've been doing that coaching for almost 5 months, I guess.
I laugh because you already know the answer, but we're trying to explain my perspective. And when you're just looking online and you're saying, oh, here's a PRI exercise, let me try it. Or here's one from this guy or one from this guy. I think what you miss is the overall direction as to how you're trying to realign your whole body as a unit. And at one point in time, I kind of thought of it like a Rubik's Cube. It's like we got to treat the whole body. You can't just treat one part of it. So once I started working with you, you kind of helped me realize that, okay, we're trying to do something with your hips. You can't treat them the same. I know you've said that directly before. So you helped me learn what's going on with my hips and what's going on with my rib cage and my lack of rotation. And without that direction, I was just doing exercises, but I wouldn't really know why I was doing them. No, we're just doing exercises and then we're hoping, did that fix my shoulder? Did that fix my hip? And, sometimes you might get lucky and you might go, oh, I feel a little better. Okay, so then you keep doing it and then you realize, no, it's really not that much better. It's returning. And then I think I can make things worse. What I can say is I had been through the first 3 or 4 protocols and I was I'd get better and I'd plateau. And at one point you had said, okay, Jim, one thing you're missing, you really have to make sure you bring your right hip forward, specific to me. And when I started doing that, that's, I think, when things started progressing even more. So yes, there's specific movements to me that without you telling me, I would have never figured out. And they're very subtle, very subtle. Actually, in my opinion, that little modification to this exercise, I think is huge for me.
Definitely, especially if you will put that into perspective and will do that like a lot of times, like for the 2 or 3 weeks, definitely.
But that's why I think if you're not working with someone like you, your results, I don't know. I don't think you'd have great success, in my opinion.
Take a closer look. This is a roadmap of treatment. So here is before. Before he was in the condition for 20 plus years with a lot of pain in the right QL, lower back, left groin, left shoulder. And he had a lot of postural issues. Both of his pelvises were not moving to either left or right direction. So no frontal plane, no rib cage proper rotation, and no hip adduction on either side, which is exactly the reason that he was not able to shift from right to left. And it took us 5 months of the therapy, as you can clearly see, and we took a lot of steps together. The most important one was progressive exercises, total amount of 30 plus movements, that we done together. I taught him everything through the video calls. Now a lot of postural habits changes, shoe adjustments, of course constant video checkups about his conditions, how he's going, how he's improving. And the most important, in my humble opinion, is constant education about why. So you cannot push your patient to go through the therapy if you don't explain him why he or she has to do these exercises, how his backhand of his body, of his biomechanic is changing because of this or that exercise. You have to basically educate your patient. Without that, it's very hard to push yourself when you are facing some plateaus, when you are facing flare-ups, and when you have to do a lot of work, sometimes without obvious results. And lastly, we've done a lot of walk changes and integration of PRI principles into the real-life scenario and movements. Alright, so for this movement, it would be necessary to use 2 rolled-up towels. The first one you would have to place right above your left lower ribs. So basically you would have to feel your left ribs being pushed up because of that towel. Now left, like I do, and the second pillow or towel you have to place underneath the left knee, like I do, like this. Okay, like this. Left heel is being connected with the wall, as you can clearly see, it's firm contact right there. Left knee is being elevated, pushed up because of that towel. Now, what you have to do next is to position the right foot slightly behind your body. So put it up and back. Now your right heel must be a little bit detached from the wall, so elevated up. Only the forefoot has firm contact with the wall at this point. So what you have to do next is to gently elevate those ribs up over the towel, just to feel the left abdominal wall being engaged. Next point, you have to press that right hip gently forward to feel the left groin being cramped and a little bit contracted. Additionally, it may give you the sensation of the left funky feeling in the left buttock area because you are stretching some tissues, which is a good sign. Lastly, as you have acquired those 2 things, finally you have to start to rotate your right leg in because you are twisting it with your forefoot. Just look at the forefoot. Bam! Right at this moment, you're supposed to feel right buttock, right groin, because you have pushed the right pelvis forward. And you're supposed to feel gentle contraction of your left abdominal obliques. And you have to breathe. Keep that in mind that you cannot arch your lower back. Your lower back must be gently rounded or flat. So hold the exercise for 5 breaths and repeat it 2-3 times. And keep it up for 1 week and let me know what happened next. See you around soon.